How do thoracic surgeons perform a precise lung wedge resection? Imagine removing a tiny, targeted piece of lung tissue that contains a tumor while leaving the rest of the lung untouched. That's exactly what a lung wedge resection aims to do. This procedure is often used for early-stage lung cancer, small nodules, or when a patient cannot handle more extensive surgery. The goal is to remove the abnormal tissue with high accuracy, preserving as much healthy lung as possible. The process starts with the patient under general anesthesia, ensuring they are completely asleep and comfortable. Surgeons now prefer minimally invasive techniques like video-assisted thoracic surgery or robotic-assisted thoracic surgery. These methods involve making small incisions in the chest, usually less than an inch long. Through these tiny openings, a special camera called a thoracoscope is inserted. The camera provides a clear view of the lung on a monitor, helping surgeons see exactly where the lesion is. Before surgery, doctors review imaging studies such as computed tomography scans to plan the best incision sites and the placement of surgical tools. During the operation, surgeons use visual cues and sometimes tactile feedback to locate the lesion. If the nodule is hard to see or feel, they may use special marking techniques or intraoperative imaging to pinpoint its exact location. Once the lesion is identified, the surgeon removes a wedge-shaped piece of lung tissue that includes the tumor and a small margin of healthy tissue around it. This margin helps ensure no cancer cells are left behind. The tissue is then sealed with staples or sutures to prevent air leaks and to close the lung tissue securely. The removed tissue is sent to pathology for examination to confirm that the entire tumor was removed and that clear margins are achieved. After the resection, the surgeon checks for any air leaks or bleeding. A chest tube may be placed temporarily to drain fluids and help the lung fully re-expand. Because this approach is minimally invasive, patients often experience less pain, shorter hospital stays, and faster recovery compared to traditional open surgery. Throughout the procedure, the surgeon's focus is on achieving a complete and precise removal of the abnormal tissue while protecting lung function. This is especially important for patients with limited lung capacity or other health issues. Every step is carefully planned and executed to balance effective cancer treatment with the patient's overall well-being. Remember, always consult with a qualified thoracic surgeon or healthcare professional for personalized advice and treatment options.